Hi, it's Dr. Gary Linkov here with City Facial Plastics. I wanted to talk to you today about a surgical upper lip lift. This is a procedure that I do a lot of, and I wanted to go through the details of the surgery as well as bring you into the operating room and show you what it looks like to actually get one done. The upper lip lift starts with very meticulous marking. I spend a long time, usually 20 to 30 minutes, making sure that the markings by the upper lip at the base of the nose are as carefully done as possible, because that will guide me throughout the surgical process. Once the marking is complete, I always show the patient the marking to make sure that they're also happy with the symmetry and how I've marked it out. I then move on to local anesthesia. So this is the process of getting the upper lip numb so that you can very easily tolerate the rest of the procedure. Once that is complete, we then prep the area. We do that by cleaning the area off with a special solution to keep things as clean as possible. And we then follow that by draping the patient. And that is again to maintain sterility, to keep things clean, and to prevent any type of infection. The surgery begins with removing the skin that has previously been outlined at the base of the nose. Then I create a tunnel underneath the upper lip skin, which allows me to then close that upper lip in a tension-free way that will ultimately lead to the best possible incision line and a very tiny thin scar that will be imperceptible in the future. I then control any bleeding with something called bipolar cautery, which is a way to burn any blood vessel that is bleeding. After all the bleeding is controlled and everything is nice and clean, we are then ready to close the incision. This is done in multiple layers. I use 3 different kinds of sutures, starting with a deep suture and finishing with a suture right on the skin. There are many different sutures that are placed in very careful, meticulous ways in order to give you the best possible chance at a beautiful closure. After all of the suturing is complete, we then apply a bandage over the area that will stay on until the following morning. Showering is allowed the following evening, and I walk you through the entire recovery process so that you can have as positive an experience with the surgical upper lip lift as possible. Thank you so much. Once again, Dr. Gary Linkov, City Facial Plastics. If you would like to make an appointment with me, call the number below. Thanks.